Assalamu alaikum. Today we will discuss about the peripherally acting antihypertensive drug. In my previous tutorial, I have told you about the centrally acting antihypertensive drugs. Okay, so we have a lots of peripherally acting antihypertensive drugs such as beta blocker, alpha blocker, and drugs that blocks the renin, angiotensin, aldosterone systems. So today, my topics is about the beta blocker and alpha blocker. So at first you have to know that where the beta blocker, that means beta receptors situated, and in which locations alpha receptor is situated. Okay, so in our body the beta receptor and alpha receptor is distributed widely, but we don't need to know all about that. Actually, we at first you have to know that the beta 1 receptor is located on your heart, and alpha 1 receptor and beta 2 receptors are located on your blood vessels. Okay, so these are beta blocker drugs. You can see here these are beta blocker drugs. That means at first whenever you think about beta blocker, then you should think that this drug is selective or non-selective, because we have beta 1 receptors, beta 2 receptors, and also beta 3, but that is not important. You should know about just beta 1 and beta 2. Okay, so those drugs only block beta 1 receptors. This is called selective beta blocker, and those drugs block both beta 1 and beta 2 receptors. That is called non-selective drugs. And always you can think that non-selective drugs have more adverse effect because they blocked all of the receptors non-selectively. Okay, so we have some selective beta blockers. Those only blocks the beta 1 receptors of heart. That's why this drug suppress the heart, that means decreases the heart rate and force of contraction. As we know, beta 1 receptor increases the force of contraction and increases the heart rate. Okay, so what are the beta 1 selective blockers? These are atenolol, metoprolol, betaxolol, esmolol, acebutolol, bisoprolol. Okay, and non-selective beta blockers, that means these drugs blocks beta 1 as well as beta 2 receptors, and this beta 2 receptor is one of the important receptors for maintaining our housekeeping functions, such as to dilate your bronchus so that you can breathe easily, or to maintain the plasma glucose level by liver glycogenesis. That means in liver, you can see here, in liver there are also beta 2 receptors, and which is important for maintaining plasma glucose level by liver glycogenolysis. Okay, so in respiratory tract, here are also beta 2 receptors, which is important for maintaining your bronchus patent. Okay, so these non-selective drugs are propranolol, pindolol, timolol, and penvutalol, and we often use these propranolol non-selective drugs. Okay, so I ask you a question about that: which one will be more advantageous for us, selective or non-selective? Okay, so now we will see the mechanism of action of beta blocker drugs. Okay, so look at the figure. Suppose this is the beta blocker drugs. All of the drugs I have shown just within a box, suppose. Okay, so beta blocker at first block the beta 1 receptors of your heart. So the norepinephrine and epinephrine cannot bind with these beta 1 receptors because the drug blocked these receptors. So your heart cannot forcefully contract and it cannot increases its heart rate. So beta blocker drug decreases the heart rate and decreases the force of contraction. By this mechanism, it decreases your blood pressure. Okay, another mechanism is beta blocker drugs also blocks the beta 2 receptors of your blood vessels. So you know that the beta 2 receptor causes vasodilation. That means beta 2 receptor agonist decreases the total peripheral resistance and decreases the blood pressure. So if we give beta blocker drug, it will also block the beta 2 receptors of blood vessels. That's why the agonist cannot bind with the beta 2 receptors. That's why vasodilation cannot be happen. That means vasoconstriction will occur and TPR will rise and blood pressure will rise. So why we will give beta blocker? For an antihypertension effect, as we have told that beta blocker increases the TPR, total peripheral resistance. Yes, that means you have understood that beta blockers in one way decreases the blood pressure by acting on heart, another way it increases the blood pressure by acting on beta 2 receptors of blood vessels. But interesting matter is that this effect is more or less than the effect on heart. That's why the neat effect is that beta blocker decreases the blood pressure. Okay, and the most advantageous effect of beta blocker drug is by decreasing blood pressure we can also control the palpitation, the reflex tachycardia. That means whenever you will use the beta blocker drug, the patient will get right from tachycardia or reflex tachycardia problem. Okay, he will not face reflex tachycardia. Okay, and the beta, you also know that in kidney there are juxtaglomerular complex, and from juxtaglomerular complex renin is released by norepinephrine and epinephrine action. This norepinephrine and epinephrine acts on beta 1 receptors of JG complex. So if we give beta blocker, this beta blocker drug block this beta 1 receptor. That's why the kidney cannot release renin, because the receptors is blocked by beta blocker drugs. And if renin is not released adequately, that means renin causes vasoconstriction. So as renin is decreasingly released, so the vasoconstriction will not happen more and more. That means vasodilation, that means total peripheral resistance will decrease, that means your blood pressure will be decreased. Okay, so by this mechanism beta blocker control your blood pressure by acting on heart, and it is not important, by acting on kidney. These two are the main mechanism of action, and its adverse effect is that beta blocker also block the beta 2 receptors of your liver, which is important for glycogenolysis. That's why if we give beta blocker drugs to a diabetic patient, then that diabetic patient may suffer from unconsciousness due to hypoglycemia, unknown hypoglycemic shock. Because when a patient undergo hypoglycemia, the sympathetic activation starts and the patient feels some sympathetic sign symptoms such as tachycardia. But now tachycardia cannot be happen as you block the beta 1 receptor by beta blocker drug. So the patient is already in hypoglycemia, but tachycardia is not occurring. So he cannot conscious of, yes, that I am within hypoglycemia. And we know that whenever our body undergoes hypoglycemia, our liver tries to compensate this hypoglycemia by glycogenolysis, which is mediated by beta 2 receptors. And now the diabetic patient cannot compensate that hypoglycemia by glycogenolysis. Why? Because you just block this beta 2 receptor by beta blocker drugs. That's why there will be more chance of hypoglycemia, and there will be no sign symptoms of hypoglycemia such as tremor, tachycardia, okay, except sweating. Sweating will be happen. Okay, so this is all about that. And now in case of beta blocker, one advantageous effect is, that means your reflex will be patent. That means your baroreflex will not be hampered. Why? Because whenever you can see that baroreceptor reflex, that means At first, when your blood pressure fall down, the baroreceptor detect it and it sends a signal to the vasomotor centers located on medulla. Then medulla sends signal in sympathetic ganglia. Then from sympathetic ganglia, some efferent signals goes to blood vessels and some efferent signals go to heart. And these signals which goes to heart, it increases the heart rate, increases the force of contraction, and those signal goes to the blood vessels, it causes vasoconstriction via alpha 1 receptors located on blood vessels. And by this two effector organ, one is heart and another one is blood vessels, your baroreceptors increases your blood pressure. Okay, and one important and interesting thing is that in between heart and blood vessels, the blood vessels component is the predominant components for increasing the blood pressure. Okay, so by beta blocker drug, we just blocking the heart beta 1 receptor. Okay, and your blood vessels is patent. No alpha receptor is blocked by beta blocker. Okay, so whenever you are standing position and your baroreceptor reflex start, that means your blood heart cannot increases its heart rate because you block the beta 1 receptor of heart, but you don't block the alpha 1 receptor. That means your blood vessels will tremendously response to the sympathetic stimulation, and the blood vessels will do severe vasoconstriction. That's why it can maintain the postural blood pressure management. That's why the beta blocker cannot produce severe postural hypertension, because your blood vessels vasoconstriction can maintain that effect. Okay, so this is another one important information about the beta blocker drugs. And some beta blockers has also intrinsic sympathomimetic activity. That means pindolol, penbutalol and acebutolol, these drugs are mainly antagonist. That means these drugs block the beta receptor, but they can also stimulate the beta receptor to some extent. Okay, so you all of you know that partial agonist, that means these three drugs are partial agonist. That means I just explain briefly. Suppose this is the beta receptors and this is a partial agonist. So what does partial agonist do? They act as agonist in presence of pure agonist. That means there is no other agonist. Now this partial agonist will act on this receptor as a agonist. But if there is present any other pure agonist, then this partial agonist will act on the receptor as an antagonist. That means partial agonist act as a agonist in absence of pure agonist and act as antagonist in presence of pure agonist. Okay, that's about it. So these drugs are not commonly used as antihypertensive drug because they have sympathomimetic activity and they can increase the blood pressure in lieu of decreasing the hypertension. Okay, and another one most important information about beta blocker, that in some cases we cannot use the beta blocker, such as the patient of asthma, patient of chronic obstructive pulmonary disease and patient of dyslipidemia, because beta blocker drug increases the triglyceride level, and in case of diabetes mellitus, as it masks the sign symptoms of hypoglycemia in case of diabetic patient, and we cannot use in case of heart block, because if you block the beta 1 receptor hard, that's why your SA note, your heart is already within heart block condition. If you more and more block the beta 1 receptor, then you may undergo the sudden heart failure. And we can not also use the beta blocker drug in peripheral vascular disease. Why? Because if this is in blood vessels, and in blood vessels there are two receptors, one is alpha 1 and another one is beta 2, okay. And this alpha 1 receptor causes vasoconstriction and beta 2 receptor causes vasodilation. So if someone have peripheral vascular disease, that means blood vessels are narrower. So the beta 2 receptor is important for these narrowed blood vessels to do vasodilation, and you are just again blocking this beta 2 receptor, which is important for this patient of peripheral vascular disease. That's why the blood vessels become more and more narrowed, because in the blood vessels alpha 1 receptor is acting over and over, and now you again block the beta 2 receptor, so the blood vessel never able to become vasodilate. Okay, so now we shouldn't use the beta blocker in case of peripheral vascular disease patient. And moreover, if you block the beta 2 receptor, then norepinephrine, suppose norepinephrine come here, and this norepinephrine will see that there is no beta 2 receptor to sit, so it all of norepinephrine will bind with alpha 1 receptors, and alpha 1 receptor will do vasoconstriction, and peripheral vascular disease will exacerbate. Okay, so this is all about the beta blocker drugs. And so these are the contraindication, and the advantage of beta blocker drug is it reduces the mortality of myocardial infarction. How does it causes it? Because if we block the beta receptor, then the metabolic demand, oxygen demand of cardiomyocyte will decrease. That's why the mortality in case of myocardial infarction will decrease. And it reduces the mortality of heart failure, because in case of chronic heart failure, if norepinephrine acts on more and more on beta 1 receptors, and your heart just working more and more just for compensating the heart failure condition, then there will be cardiac remodeling. And to prevent this cardiac remodeling, we use beta blocker, so that the more and more norepinephrine cannot bind with the beta 1 receptor. That's why we will prevent the heart from doing more work, and we can prevent the heart from going into cardiac remodeling. Okay, and our another advantage is, in case of beta blocker drug, patient will not suffer from reflex tachycardia, because to do tachycardia, your beta 1 receptor should be available, and now by giving beta blocker, we are just blocking the beta 1 receptor, so your heart cannot respond to norepinephrine to do tachycardia. Okay, so this is one another advantages. So this is all about the beta blocker drugs. Thank you. In another tutorial, we will discuss about alpha blockers and renin angiotensin aldosterone system affecting drugs.